Hello my lovelies, and welcome to today's video. My name's Alya and I'm so glad you popped in. So today we're going to be creating this beautiful colourful look that's inspired by this wonderful colourful Tichel. It's got greens and blues and oranges, and I've definitely included all those things in my makeup look, including a bit of a ombre out black corner, so all very colourful and fun. So I hope you enjoy watching me create that look while I tell you about an actually very scary syndrome, which is when you might lose your sight temporarily for a short period of time. And it can be 10 seconds, it could be up to a day. And I'm just touching on the various things that may be causing this, and also the various tests your ophthalmologist or orthoptist may do for you that can be helpful in diagnosing what went wrong. And a lot of the time it's your eyes' way or your body's way of communicating to you about what might be going on in the bigger picture. So taking some of that unknown away and hopefully making it less daunting if you ever were to experience something like this. So please do stick around to hear a little bit more about what might cause a temporary vision loss and this look. So as we jump into this really fun look, we're not talking about a particularly fun subject unfortunately today, so it is a little bit of a somber or very serious topic today, but I think it's important to talk about it. And I do think that it's important just to know at least the surface of what goes on so that you can self-assess assess somebody that is speaking to you about this sort of topic. Because I think that with a lot of these things, they seem scary and it's hard to judge, what's going on and how to know whether something is important or if something is, you can rely on your body sort of resolving on its own. A lot of the time with these things that involve vision, I think that it's important to know which specialist to go to as well. Like, are you going to be seeing an ophthalmologist because it is your vision, or are you going to be seeing a neurologist or cardiologist? And that's what I'm going to be sort of really delving into a bit more today. So let's divide this video into this loss in one eye or two. Now, that's extremely important. That is one of the major factors that I think is probably one of the most important things to sort of know when you're seeing any specialist, especially when you're coming in with the eyes. So it's important to know if it's happened in one eye or both at the same time, and if you've had more than one attack, did it happen in the same eye both times? That's extremely important. And the reason for that is because of the way that the brain anatomy, or the eye anatomy in this case, exists. We have this really wonderful chiasm that sort of sits right in the middle of the brain here. So as the optic nerve goes backwards, edges backwards, it kind of crosses over. And at that chiasm, we have a lot of really important anatomy. One of the things that sits there is the pituitary gland. And that gland has a tendency to grow, it has a tendency to do funny things, and so forth and so on. There's a bunch of other little sort of glands and whatnot in that area. It's a very, very densely packed space. So one of the really important things to the clinician or to the doctor will be how many eyes are involved, and are they involved at the same time? That's a really important question, and that will really guide the doctor to know which anatomy to start looking at. The other thing that's extremely important is to understand how long it lasted. Is this something that really did last 10 seconds? Or is this something that lasted over a day? Or is this something that just was a fleeting moment? Because all of those things are really important for the doctor to know. It's a really important part of the assessment, and it will again guide us in terms of which anatomy is involved. Because the faster something can pass, it kind of guides us towards whereabouts it's all happening. Like, for example, migraines don't tend to just appear and disappear, whereas a blockage may. So one of the things that we would be looking for is a blockage caused by a bit of plaque of some sort, like a cholesterol blockage, like an embolus or a thrombus, so something caused by a thickening in the blood or excess cholesterol, things like that. Another thing that we might be looking for is if the vessels have hardened. That's another reason why things might not be passing through as efficiently. A spasm of some sort, like a migraine, could be also one explanation. High or low blood pressure may be another cause, so more of a vascular in nature event. What's another one? Migraine is definitely one, but migraines you can't really measure as such, because you can't really see a migraine happening. You have to sort of just assume, based on elimination, that that's what's going on. The other thing that can definitely be eliminated clinically is glaucoma. And that's where, especially if it's sudden or transient, that's when the eye is actually looking at almost closing, or the pressure is spiking for some reason temporarily. And that's actually going high enough where it's causing visual symptoms. Now, you don't see that very much, but that's definitely something that's actually quite accessible in clinic, which is convenient because at least that way you can physically see that happen. Same thing with the vessels. There are ways to sort of put pressure on those vessels clinically to see how they would respond. And depending whether they open or close or if anything sort of comes of it, you can actually assess something that's going on in a vessel clinically pretty easily. For example, if there is a occlusion of some sort, like if one of the vessels is about to be closed off, there are ways to sort of get those vessels to be, clinically put under pressure and see how they respond and see if there's any blockages or closures anywhere, or if the vessel doesn't respond to pressure the way you want it to. So let's talk about some of the tests you would expect to do if you're having a transient loss of vision or a temporary loss of vision. I would typically do at least an OCT and photo. That would be my absolute minimum go-to. The reason for those two tests is because they will give me a map and a geographic sort of just a photograph, right? Just a documentation. But the thing is that especially little plaques and little blockages, they're very good at reflecting light because they're not really meant to be there and they're a bit thicker than everything else. So where a vein is full of oxygenated blood or even deoxygenated blood, it's just a nice little red picture. Whereas if something's sitting in there and something's making it not as translucent as it would normally be, I'm going to get a really nice flashback from that. And it's a really, really obvious thing to see when light goes into the eye. So a flash photo is actually really valuable in these cases, especially if things are pretty central and visible, in the very sort of epicenter of the eye. OCT, same sort of story. You can sort of tell what's going on with the vasculature really well. And, it tells you a lot about the nerve as well, if there's any sort of pressure going on there. Definitely gives you just a very, very good indication of what's happening anatomically inside the eye. Another really good part of that assessment, what it really gives us is a really good view of any kind of swellings that are happening inside the eye space. So this is all about, a really decent assessment of that front part of the anatomy, that pre-chiasmal or before that central part of the anatomy. Things that happen behind that chiasm, sometimes you can tell by symptoms, and definitely the field test, that's another really important test that what I love to do for these type of cases will tell me, is if there's any kind of blockage or pressure, like say a tumor or aneurysm or anything like that, something really massive happening inside the brain towards the back, there's definitely going to be, sort of lingering signs of that going forward. So even if you feel like your vision's restored, there may not be a full restoration, or the brain might be compensating for that somehow. And a visual field test definitely sets up the environment in such a way that, that sort of thing is really, really well represented and really, really obvious. So it's also sometimes a really valuable test to do and pretty easy to accomplish. It doesn't take long. It doesn't hurt. You don't have to go anywhere special to do it. Most clinics will have one, things like that. And certainly much nicer to do than having to go into an MRI or having a CT scan. And it's a really great initial exclusion of what's going on in there. Another thing to expect is that the doctor might send you off for a cardiology assessment, something like wearing a holster, like a heart holster for 24 hours to see what's happening with the blood pumping into the eye. And another really popular test that we do a lot with these type of symptoms, if we haven't sort of concluded why it's happening in terms of eyes, is a carotid Doppler. So that's another term you might hear. A carotid Doppler sounds like it's really fancy, but all it is it's an ultrasound of the neck where the carotid arteries sit. So we've got two really big, juicy arteries. You might be familiar that when we test for a pulse, we will test around here. That's because you've got these two really fat, juicy arteries traveling in through the neck, and they are the main feeders to the eye and to the eye blood supply. And if there's any blockages there, that will sometimes also cause, not enough oxygen to come inside the eye, and that's a really big cause of some eye symptoms as well. So there might not be the eye as the problem at all. It may actually be the artery that's feeding the eye instead. Once again, it's a really scary concept, but in practice, it's just about finding out what's going on so they can be dealt with. Sometimes it's just a matter of eliminating all the different things that could be causing your problem. And another really common outcome of all of this is that you get some medication. So it may not actually be such a hugely scary outcome, but it's worth finding out because all of these things could sometimes be a precursor for stroke. And it's most definitely a nice way for the body to sort of give you a warning that can be investigated, can be really, really easily, looked into, and then you don't end up with a horrible, horrible health scare. The term that your doctor may be using is Amaurosis fugax, which is basically talking about the fact that there was vision loss for a temporary amount of time. It's just a fancy way of describing it. A lot of these terms sound a lot worse than what they actually are describing, so don't let any of that scare you. It's just basically either Greek or Latin way of saying exactly the same thing. So, it's just a way of communicating it in a professional setting. A lot of patients tell me it's designed to scare them because the words are often so ambiguous to someone who doesn't know what they are. Some of them are really obvious. Sometimes you get terms that are just exactly the same in English as what they are medically or in Latin, and sometimes you get terms which are completely unrecognizable, and Amaurosis fugax is going to be one of them. So once you have gone into a clinic, and I would probably start with ophthalmology because an ophthalmologist can then accurately assess if you need neurology, if you need which sort of scans, which more complicated scans you may need going forward, because you may be avoiding having an MRI or having a CAT scan or even having a Doppler by first being assessed by the ophthalmology department. Because what if it was just something pretty fairly basic and very eye-based? You know, what if it was just a matter of pressure? And I mean, it's scary in of itself, of course, but that's so easily treated, and it means that you can avoid having any kind of scary investigations. You may be claustrophobic, or you may be hit up with a big medical bill with all the investigations, when sometimes ophthalmology can actually reveal what's going on pretty accurately in the first visit or 2-3 visits. You know, by that point, we normally know what's going on. And finally, I want to tell you about something else that can be going on, and that is a fairly uncommon thing that can happen, but especially in older patients, we do definitely want to check for it. And the questions your doctor is going to ask you, or the clinician will ask you, is, do you have any tenderness through the hairline from which the eye that's experiencing the attack is getting? So let's say you lost your vision in your right eye for a couple of minutes and it came back. They will ask you, is it sore to comb your scalp through here? Do you have any kind of tenderness or headache throughout the scalp on that same side? And that is questions that's talking about giant cell arteritis. And that is when the actual artery becomes inflamed. So a lot of people confuse that for arthritis. No, not arthritis. Arthritis is inflammation of the joint. So for example, the knee or the wrist or the knuckle, something like that. Arteritis is referring back to the artery. So the actual blood vessel that's carrying not up the neck into the brain, but actually through the scalp into the front of the face. And some of that swelling can most definitely cause some vision changes. Retinal migraines or visual migraines can also sometimes cause temporary vision loss, and they're fairly innocent most of the time. So allowing your doctor to assess you accurately and allowing those tests to take place can usually assess you to the point where you don't actually need to go to further investigation elsewhere, which is really lovely how the eye is such a big window to your health. Maybe not necessarily to the soul, although that theory also can stand true, but definitely to the bigger picture of your health. So I hope today's video has revealed a few of the little hints and things that you might meet if you ever did have that experience. And I'm sorry if you do have that experience. That's terrible, because it is scary and it is worrisome, as I mentioned earlier. But the idea is that knowledge is power in this case, especially when it comes to your health. The more you allow your doctor to know, the better they can treat you and the better that you can avoid future much more horrible things happening. A lot of the time when we get these symptoms in the eye, it's just a lovely kind of our body's way of communicating with us. And eyes, and as I've mentioned in previous videos, are pretty easy to look into because we do have a big old hole, a big old aperture in the front, in the pupil, and therefore it's fairly painless and easy to then assess what's going on at the back of the eye. Unlike some of the other parts of the body, like the brain, which is directly connected to the eye, where it's, you know, MRIs, it's all these assessments, it's all these tests, and it's a lot more difficult to look inside and get a clear picture of what's going on. So as always, my lovelies, I hope today's video was informative. I hope it wasn't too daunting today. I just wanted to kind of get a basic understanding of these different things that can happen to the eyes out there so that you are loaded up with useful knowledge should you ever come across anything like this. If you're interested in eyes and learning a little bit more about makeup or eye health, or you're more interested in the scarf segment on this channel, please do subscribe. Also head over to Instagram for more exciting stuff. As I filmed this today, I've already missed out on uploading this week's midweek wrap-up, and I'm so sorry about that. It was just an editing glitch, and I just couldn't keep up with it, all the things that are going on in life, and also having so much trouble uploading the videos. So I do hope to upload that video next week for you. And I hope you enjoyed today's, wherever you are around the world, my lovelies. I hope you're having an amazing day. I hope you're staying safe and healthy and happy. And I can't wait to see you on the next one. Bye.